Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Wendi Goodson-Celerin, who is the Executive Vice President and Chief Nurse Executive at the Florida Health Sciences Center, about Tampa General Hospital's new ambient listening solution. So, hi, Wendy, how are you?
Hi, good. Thank you. Thank you for having me.
Of course. Thanks for being here. So I'm excited to talk to you about this topic today. Ambient listening is one of those kind of hot topics up next to AI, I feel like, in healthcare. So to get us started, can you tell me a little bit about the benefits of ambient listening for nurses and patients?
Absolutely. The benefits for our ambient listening is this allows the nurses time back with their patients. In most organizations, nursing spends a great deal of time charting. So whether they're doing it in bulk charting halfway through their shift, at the end of their shift, but still it's a great deal of time, a percentage of their time that they could be hands-on working at the top of their license. So giving them time back. This
Mhm.
also allows the patients to be more engaged in their care. So as the nurse is there at the bedside, she's interacting, she's communicating with them, they're hearing everything, so they're well educated and a lot they can ask questions, get clarifications, and be teaching all at the same time. So just very, very efficient use of time and technology.
Mhm. Absolutely. Yeah, I was talking to somebody else about this topic the other day, and I was saying even my vet uses ambient listening now at our appointments with our dogs. So it's definitely very helpful in all kinds of different healthcare. So tell me a little bit about the new ambient listening solution that Tampa General is implementing.
Well, it's pretty neat. It is with Epic and Microsoft, and
Mhm.
we have it on one of our units who's helping build the solution. So they're tweaking it along the way, making sure that it works, according to the workflows and it makes sense. But it's a great tool that the nurses come in, they're doing their assessments and they're speaking and running through that top, head to toe assessment, and it is recording it. They can have a normal conversation about vacation, how's the kids, but the solution knows what's key and what's important, and then it
Mhm.
pulls that information into the chart. And then the nurse at the end finishes her assessment and those type things, and then she goes to the chart and then she validates it, and then hit enter, and it becomes part of the chart. So saving her a significant amount of time.
Mhm. That's so interesting. It's so fascinating to me how it can automatically pull that information and separate it. That's really cool. So, talk to me a little bit about why you decided to implement this solution and maybe not something else technology related. Why ambient listening?
Well, when we're looking, our physicians were using it. So,
Mhm.
it's kind of like a dream for a nurse to be able to
Mhm.
really just speak and talk and have, that futuristic, thinking.
Mhm.
And so you looking for a solution or something to help the bedside nurses. Our healthcare environment is very fast paced, intense, and you want the nurse to be able to spend time with the patient as much time as you give them back to spend actually with the patient, educating a patient, caring for the patient, right? And so not spend time doing administrative tasks, which is kind of like charting. And so
Mhm.
it allows, for all of those things. So when we're looking to see how can we be more efficient, save time, um, the impact it has on patient experience and the nurse satisfaction, it was a win-win for us. And it's like, why wouldn't we go with this? It's simple. And again, we're kind of in that advanced work with Microsoft and Epic on this, and so we're tweaking it
Mhm.
so it can be scaled. So we're enjoying our role through it all. It's a little tough at times, but we're doing it for the greater good.
Absolutely, yeah. So, how are you equipping your nurses for this change in workflow and training them to use the technology?
Well, lots of training, lots of support, physical, in-person support as well. One thing for the nursing team, which was a challenge for them, was really, really narrating their care. So,
Mhm.
normally, the nurse will go in and say, I'm going to do, my assessment. I'm going to listen to your lungs and your belly and, do those things and check your IV site, just different things they would be doing. And so, you just say in general, I'm going to be doing my assessment. And so now you're really talking through every step of that. So you're narrating your care all the way through. And
Mhm.
so, that's not easy sometimes for nurses to do that. They, want to make sure that they're absolutely right about everything, and, stopping and starting sometimes when the patient asks a question, oh, what does that mean? And so,
Mhm.
you say you hear, some rails in my lungs. What does that mean? And so, you have to explain what that means to them, but it educates them at the same time. So really supporting them, boots on the ground, listening to them, reevaluating what they're telling us. So when they're bringing questions, or when they're seeing that, if I have a nurse who has an accent or something's not picking up as clearly as we would like, and taking it back to the developers and say, we're having little issues here and there, and so they're making the tweaks that's needed and things like that. So really listening to them, supporting them, and being boots on the ground with the technology. We have various generations of nurses at the bedside, so some are very good
Mhm.
with technology, and some maybe need a little bit more support around that. But overall, they all know the medical records, so this was a new piece for them.
Absolutely. Yeah. I'm glad you mentioned the patient reaction because I feel like if I started hearing my nurse or doctor saying a bunch of things, I'd be like, what are you talking about? So it's good. Yeah. So, speaking of the nurse reaction, has there been any hesitation among nurses to adopt the technology? And if so, how are you sort of quelling those anxieties?
I think the resistance was just really talking out loud,
Yeah.
what you're thinking, and using medical terminology and having to explain it. Um, but they do get over it, and work through that, with the patient. It actually builds a stronger bond, and
Mhm.
connection with the nurse and the patient. And so it's a little uncomfortable in the beginning, but in time and the repetition of it, they become more comfortable with it. So just really, ensuring, the confidence that come with it. You're on the cutting edge. You're part of the future and what's going to be built and scaled for nursing in general across the country.
Mhm.
So we know there's going to be some of those apprehensions and some anxiety a little bit, around that. You may have some shyer nurses and some that are, robust and ready to go with it. Have
Mhm.
nurses like love it, and then others are kind of more reserved about it. So just helping those nurses who may be a little bit more reserved and using it, and just being that boots on the ground and just supporting them through it.
Absolutely. So, do you have any outcomes that you'd like to share about how this strategy has been doing so far? Any predictions about how it will impact patient outcomes?
Well, we're still in the building phase and still working through it.
Mhm.
We have seen improvements in our patient experience.
Mhm.
I'm not going to say it's just this one piece that's doing it, but it definitely has improved in that sense. We have our patient care techs who also use it. Our registered nurses and our patient care techs use it. Patient care techs love it. They are running with it.
Mhm.
They're really, enjoying having that time efficiency, and to be able to really be available to help our patients and delivering patient care versus going the sit down and chart type thing. So they're really enjoying that, and actually, want us to move faster
Mhm.
across, other units, at least our patient care techs are. So, we're still in the early phases, but they're adopting it. They're adopting the nurse a little bit slower just because we got tweaks and just different things. With our patient care text, it's more very discrete fields of information, so the system is easier to adapt and to document.
Mhm.
Nursing, when you're speaking, you're talking different terms. Sometimes it may interpret something like not quite right, and so she has to go into the chart and tweak it a little bit. So.
Yeah, absolutely. And then my final question for you, obviously, again, like you're saying, ambient listening is going to be a nationwide phenomenon sooner rather than later, I think. So, do you have any advice for CNOs who might want to try a similar strategy?
Absolutely. I would say be bold and do it, right?
Mhm.
It is the future. It is what we need as in our nursing profession to help us be more efficient. Our environment is forever changing. It's intense, it's fast paced. And we have technologies and solutions that can help us. And so why not use it? I
Yeah.
would say one strategy that I would use is, when you're considering bringing this technology on, is to start probably about 2 to 3 months early with having the nurses narrate their care without, the ambient listening. So then they're, become more comfortable with it. So when you actually are ready to go live, it becomes more natural when you're speaking and talking. So just having that repetition before you actually go live is, I think, is would be a good game changer for them.
Absolutely. Yeah, practice makes perfect, right?
Absolutely, absolutely.
Absolutely. Well, thank you so much, Wendy, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening. Thank you, Wendy.
Well, thank you. My pleasure.